Heart disease is a leading cause of death in the United States for both men and women. Today, we are going to talk about a very important subject, the ignorant warning sign of heart attack. Feel it, ignore it. This is Natural Health Talk Show. What is the heart? The heart is a muscular pump a little larger than your fist. It is one of your most important muscles. The most common cause of heart attack is coronary heart disease. What is coronary heart disease? The coronary heart disease is a type of heart disease where the artery of the heart cannot deliver enough oxygen-rich blood to the heart. The coronary microvascular disease happens when the heart tiny blood vessels do not work normally and is more common in women. Coronary heart disease is the leading cause of death in the United States. About 18.2 million American adults have coronary heart disease, making it the most common type of heart disease in the United States, according to the Center for Disease Control and Prevention. Many people have no symptom. They do not know they have coronary heart disease until they have chest pain. For most people, coronary heart disease is preventable with a heart-healthy lifestyle. What is the difference between a heart attack and a sudden cardiac arrest? A heart attack is when the blood flow to the heart is blocked. It is a circulation problem. The sudden cardiac arrest is when the heart malfunction and suddenly stop beating unexpectedly. One thing to remember about sudden cardiac arrest is an electrical problem. Compared to heart attack, is a circulation problem. People often use this term interchangeably, but they are not synonyms. The most common sign of heart attack is chest discomfort or pain, which can spread to your arm, neck, jaw, or back. Chest discomfort or pain can last for several minutes or come and go. Please, a heart attack requires emergency treatment to restore blood flow to your heart. Always call 911 immediately if you think you or someone else may be having a heart attack. Always call 911 immediately. Take your phone, call 911 immediately if you think you or someone else may be having a heart attack. Remember the difference. Heart attack. A heart attack and an artery supply blood to your heart become blocked, stop blood flow, and reduce the amount of oxygen that get to your heart. It is a circulation problem. A person having a heart attack is usually conscious and maybe complain of chest discomfort or pain or other symptoms. Compare to cardiac arrest. A cardiac arrest occurs when your heart stops beating due to an electrical malfunction. That's why I told you the sudden cardiac arrest is an electrical problem compared to heart attack is a circulation problem. Because a person in cardiac arrest will not be unconscious compared to a person with heart attack will be conscious. Because a person with cardiac arrest is not able to respond and will not be breathing. This is because their heart has suddenly stopped beating and blood can no longer flow to the brain, heart, and lung. A cardiac arrest is a medical emergency. If the heart is not restarted immediately, cardiac arrest can lead to brain damage and then death. Every second counts. If you witness a cardiac arrest, please call 911 immediately. If you know CPR, giving chest compressions and using a defibrillator, AED, can improve a person's chance of survival. What is the heart attack warning sign and symptom? Recognize the symptom of a heart attack and calling 911 could save your life or the life of a loved one. It is important that everyone, both male and female, know the warning sign and symptom of a heart attack because early treatment is vital. The longer a blockage is left untreated, the more damage occurs. This is Natural Health Talk Show. Today we are talking about the ignorant sign of heart attack. You feel it, ignore it, and know the difference about heart disease. The most common heart attack warning signs are, listen to me please. If you have chest discomfort or pain, we call it in medicine angina. Angina occurs when your heart muscle doesn't get the blood supply and oxygen that it needs. When there is not enough oxygen going to the heart muscle itself. This can feel like uncomfortable pressure, itching, numbness, squeezing, fullness, or pain in your chest. This discomfort can spread to your arm, neck, jaw, or back. It can last for several minutes or come and go. People experience dizziness, lightheadedness, feeling faint or feeling anxious, nausea, indigestion, vomiting, shortness of breath, or difficulty of breathing, with or without chest discomfort, sweating, or a cold sweat. And you remember what I said when I first started? Feel it, ignore it. It is one of the biggest cardiac warning signs. Most of people ignore is the tingling in another part of the body. If you feel it, do not ignore it. It could mean you are at risk of an actual heart attack. I'm going to repeat it again. If you feel it, don't ignore it. Tingling, that's when you feel a little sensation. Most of the time people will feel it in their feet, in their toe. But if you feel it in another part of the body, it could mean you are at risk of an actual heart attack. Because new research show how that sensation in your feet and toe could be a warning sign. It is called small fiber neuropathy. If you feel it, don't ignore it. Tingling in another part of your body, it could be you are at risk of an actual heart attack. People may feel in their lower extremity, tingling, pain, needle, numbness, or like a burning pain. Most likely people who may experience those people with overweight and diabetics, also obese. If you feel that, please, is a warning sign that you may at risk for an actual heart attack. I know some people may say they think It could be the conditions. Is the one inside of how to control inflammations. But you should know that inflammation is a key driver of overall cardiovascular risk. Please, if you feel it, I'm going to repeat it again. Go to your doctor for a checkup, especially if you haven't go to your doctor for a while or you overdue to have a physical examination. Because it is a warning sign your heart is in trouble, you may in the risk of having a heart attack. There is a powerful secret to reducing heart attack and stroke risk is hidden in your mouth. There is one of my listeners who called me and asked me, what is the first line of defense for your heart? The first line of defense for your heart isn't what you think. I'm not saying forget your cardiologist. You should also go to your dentist to see what's going on in your heart. Please, if you are going to your doctor to have a complete physical examination, you also should go to your dentist. Because when you go to your dentist, in your mouth, you could see what's going on with your heart. Because new research showed that a powerful secret to reducing heart attack and stroke risk is hidden in your mouth. Listen to me, please. If your dentist tell you that you have gum disease, it is a red flag that your heart and artery are in trouble too. I'm going to repeat it again for you. If your dentist tell you you have gum disease, it is a red flag that your heart and artery are in trouble also. 2 years ago, researchers cautioned that the link between gum disease and heart disease might be coincidental. They said that just because there happen to be a link, that is not the same. There was a research for 3 years. Researchers followed 420 people with gum disease. The tracking progress of their treatment. They used ultrasound to measure carotid artery plaque. They see that as their gum health improved, plaque buildup show significantly very good improvement. Researchers claim that managing the periodontal bacteria profile can prevent or slow gum disease and artery disease. They believe that gum disease bacteria trigger an immune response that set off inflammation. As we already know, when inflammation lingers and becomes chronic, it aggravates artery plaque buildup. That's when your arteries are in deep trouble. There is something also I'm going to briefly talk about is diet soda. Diet soda are killers. A new study that tracked nearly 60 women has found those who regularly drink just 2 or more diet drinks a day had a much higher risk of dying from heart disease than those who never did. The results come out of data from Big Women Health Initiative study. This is the only study to link diet soda to deadly heart problem. In 2011, research presented at the American Stroke Association conference said that drinking diet soda every day is associated with a 48% higher risk of heart attack and stroke. And way back in 2008, research of the American Heart Association journal Circulation implicated diet soda as a cause in raising the risk for heart disease and diabetic by causing metabolic syndrome. So if you want out there who's a diet soda lover, please listen to what I'm saying to you. Many of you asking me non-steroidal anti-inflammatory prescription drug as well as OTC painkiller. When you have a cold or flu, is okay to take. I'm telling you right now, it's something you might think twice about before, when you have a cold or flu or pain, that you go and take those medications. Those kind of medications during respiratory infection can increase your risk of suffering heart attack. Like, for example, ibuprofen. The active ingredient in brand such as Advil. Ibuprofen is an active ingredient in Advil, Motrin. Naproxen, which is you find in Aleve and Naproxen. Celebrex, Cataflam, Voltaren, Cambia. It seemed to me no one pay attention despite all those warnings about those medications. On the top of that, FDA, which is the Food Drug Administration in the United States, issue a report. Those medications can up your risk of heart failure, your potential of getting a heart attack or stroke grow the longer you take them and the higher the dose. And they say you don't have to be taking them long term to be in jeopardy. As your heart risk goes up, even during the first week or when they are used only on occasion, despite FDA warning, they are still recommend first line for treatment of cold and flu, those type of medication. It is up to you to decide what to do. You are the master of your mind, emotion, and balance. This is your body. You decide what you should take and what you should not take. Even the Infectious Disease Society of America, on February 2, 2017, Science Daily, they say common pain relief may increase heart attack risk during respiratory infection. If you have a cold or a flu, you're taking those medications, it can be increase your risk of having heart attack. Myself, I lost one of my little brother from a heart attack. He has a cold. In 2016, he has a cold. He take those medications. He take Motrin with the cold, and he died, and he slept with a heart attack because he was living by himself. There was nobody around to save his life. I urge you, please, listen to my advice. Researchers from the United States, from the University of Montreal, Finland, United Kingdom, cardiovascular program at Brigham and Women Hospital caution about non-steroidal anti-inflammatory drugs, those medications that I just told you. The bottom line is that using this drug can increase risk of suffering a heart attack by 20 to 50% compared not taking them according to those researchers. It's not only that. Having a heart attack isn't the only danger this drug poses. Previous study has found they can put you on a fast track for a stroke, kidney failure, and severe stomach bleeding.